From that point, when the receptionist checks in the animal, if it is a dog, we would normally have the client weigh the animal and then enter in the weight of the animal up at that point. But we also have here the signalman, it's a canine, neutered male, the breed, and the age of the animal. And on the check-in sheet, it verifies the patient's name and the client's last name, along with the patient's ID and name again. There's a reason why it is here. It is here for a dental procedure. Any additional notes here would be where if the client said that the dog has also been limping, or any other reason or problems that the owner has stated, not stated previously, but has stated upon this arrival. On this check-in sheet is also a list here that basically covers all the vaccines, the 4DX test, and gives the dates of when they are due, so we can verify when the last time all those were given and when they'll be due. There is also a brief history. We have not been on a purely computerized version very long, so the history is very short. Only what has been done since February of this year. Along with that, the few other forms that we have is a surgical and hospital authorization form for the client to sign. This is also pulled up from the computer. It will automatically fill in the client's name, address, phone, and everything about the animal itself: species, breed, sex, and age. It is basically the client authorizes us to hospitalize the animal for the day. And the next form we have is the treatment and surgical consent. Again, the computer fills out most of the information concerning the client and then the pet itself. And here it signifies that the owner is giving us authorization to perform the procedure, and fills in that it is a dental cleaning. This form here just basically allows us to perform the procedure itself. There is a section here that says if we happen to find parasites on the dog itself, it gives us authorization to treat the animal with a topical, maybe a Capstar. And it covers some fees that the owner is responsible for medicines. Any x-rays are needed. And we just have this owner sign this as well. There's also another form here that we do on admission. This is not from the computer. It is not entered into the computer yet, so this is just a paper form that will go into the chart. We ask when the animal last had food and water. Any problems or concerns a veterinarian needs to be aware of. This is another chance for the client to state that there is something else that they would like us to look at. It also has a few check boxes here where we can have the client, we give them a price for any in-house pre-anesthetic profile, which includes a hematocrit, a blood chemistry panel, and electrolytes. They can either say yes, they would like it, or no, they would not. It does have here that a 4DX test is required if the dog is over 6 months of age. And for cats, feline leukemia and FIV test is required for any cat that does not have any record of a negative test, and it gives prices for the client to be aware of at that point too. And this is just one last reminder that usually we recommend patients over 7 years of age to have a senior blood work panel completed prior to the surgery. This is also a chance for the client to have a microchip implanted. Gives a price there, and if they would like it or not like it. We do all the registration online for the client if they do want that done here. And also the last part is a chance for the client to authorize an IV catheter installed. This, we discussed with the patient that it's easier and faster to access and administer any drugs that are needed in case an emergency arises during the procedure that the patient is here for today. It also gives a price for that as well, and we do state that if the pet is 7 years or older, it is actually mandatory for any procedure done. We also state that we may give IV fluids during the procedure. It gives a cost for that. And this is by the bottom for the client to sign and date those forms.